My name is Lily from Little Baby Sleep, and I want to talk to you today about teething. Many of you have experienced teething, or the fun parts that come with teething, or even thought that your baby was teething or wondered whether they were. And I hear this a lot of questions with regards to teething and sleep. Is teething interfering with my little one's ability to fall asleep? Are they in pain? And it's often something that comes up when I talk to a parent that is struggling with sleep and they tell me that it's probably teething. And so I wanted to share this information with you this week to help you understand what teething is and what teething is not and how it affects sleep, because I don't want you to not see a sickness if there is one, or maybe a bigger issue, or maybe it's something else and that we could fix it and address it, and so you don't have to spend time um, away from the great things in life and being exhausted because your baby is continuously waking up at night and having long and having night wake ups or having trouble falling asleep. So I want to clarify a lot of things about teething. And I don't do this to dismiss any of your concerns at all. You all have valid concerns, and it is really just to shed light into maybe some situations that you might not know. And you might be assuming it's teething, but maybe it's not, or maybe you can find out for sure and you can come up with a plan to resolve it if it's not resolved. But most likely, and you've heard me say this a lot, is if you have been struggling with sleep for more than a few days, you are most likely not dealing with teething. It could have started with teething, I believe that for sure, and it could have just become something else, something more long term, some kind of onset association that they have with, and we've changed our approach, and our baby has changed their response. Right? I always say if we change the way we respond and are consistently responding a certain way, and then change that, our baby is going to change their expectation. So I think we have to look at it that way as well. Is in the moment, of course, you want to do everything to help comfort and to provide relief for your little one. But is that becoming a long-term thing and a long-term expectation? And that's really what I want you to think about today. Now, teeth are going to be growing as your little one, gets older and goes into their toddler years and preschool years, up to the age of 2 or even sometimes beyond that. And teething is going to be happening throughout that. But there's a lot of other things happening with your little ones as well. They're growing, they're developing exponentially in the first year of their life. And they're going to be getting sick. And so there's a lot of different things that will happen that will make you question what is really going on. But I want you to know that, the actual discomfort and pain that comes from teething is usually when the tooth is just breaking through those sensitive membranes in the skin, on the gums. And you'll be able to tell when that's happening because you can just look in their mouth and see that their gums are inflamed, that there's a little white nub or a little white tooth underneath. That is the best way to tell if your little one is teething. Yes, they might have increased drool, but all babies drool. It's just if you notice an increase in drool, fussiness. Most babies get fussy, especially when they're overtired. So I don't want you to get confused with that, because often when a baby gets overtired, they are more sensitive to pain. And that if there is discomfort, they're going to be fussier. So I want you to watch out for that they're not getting overtired. And often that's usually what causes the fussiness. Now, if they're in pain, then you should get checked out by a doctor just to make sure it's nothing else and to rule anything else. If there's a high fever, please go get checked out. If there's diarrhea, vomiting, anything like that, that should be something that you're going to your doctor to see, because that's not likely to be teething. The fever will happen, but it's like an elevated temperature and not a fever for teething. And so just understanding that will help you decipher what is going on and your approach, right? Of course, you're going to want to comfort your little one if they're in distress. We all will. And maybe use Tylenol or Advil, not medical advice here. You would need to talk to your doctor before you do any of that. But there are some things that we can do if we see that the tooth is coming through. It's within that two-day period, to help relieve that discomfort for them. Anything cold really helps. Just wetting a cloth and putting it in the freezer for a few hours will help. And anything that they can bite and chew. I also really love to just take a look at their gums, wash your hands obviously, and just massage those gums a little bit to help them. And then at the last resort, Tylenol or Advil will help with the pain for that 1 or 2 nights. And then it should be gone. And if your baby is still waking up after that period of time, then I want you to reach out to me, because there might be something else, or reach out to your doctor if you feel like they're in pain. But if you feel like, okay, I don't understand why they're still struggling to fall asleep, or they're screaming at bedtime, or they wake up screaming, maybe it's time to book a call and let's talk about what it could be that we can help fix, that we can get to the bottom of what's really going on and fix that. Because you could be going on 2 years thinking it's teething, but really it's something that we could have addressed and fixed, if it does have to do with sleep. So I just wanted to put that out there, and make sure you have all of the information you need. That's exactly why you're here and you follow me, is to get more information. And like I said, I'm not a medical doctor, so you should go see your doctor if you have any issues. But I know, and the studies are very clear on, there has been a lot of studies done on teething and sleep, and it is very definitive that teething does not cause sleep disturbances. So it does not cause long-term sleep disturbances. So if it's a night or two, for sure it could be teething, but it's generally not very it's not likely at all that they will have trouble sleeping in the long term because of teething. So that's where I come in and can help you resolve that situation. So I hope that was helpful. I have lots of resources on. You have a wonderful weekend. I hope this was helpful, and we will see you next week and This Week in Sleep. Have a wonderful week and take care.